A female patient, Mrs. Chen, 82 years old, was diagnosed with lung cancer. She was emotional and refused to receive both medication and therapy at first. One day, the doctor had a meeting with Mrs. Chen in the ward.
Hello, Mrs. Chen. How are you today?
I feel very sick. I keep coughing day and night, and sometimes even cold with blood. What happens to me? Am I going to die?
I'm sorry to tell you that you are diagnosed with lung cancer, but it can be treated by both therapy and medication. Don't worry so much. We will help you. Just follow our instruction.
What? How come? I feel sick for a long time, but the nurse and the doctor didn't help me at all. And you guys tell me I have cancer now.
The main cause of cancer is due to your long-term smoking habit. That's why you keep coughing.
What? Jesus! I'm not going to receive any therapy. It must be really painful, man.
Chen was emotional and very angry. The doctor let her calm down first and asked a nurse to look after Mrs. Chen. When asking about the health status of Mrs. Chen,
How do you feel this day, Mrs. Chen?
Good. I feel good yesterday because I strongly believe my pain will go away soon. And I kept eating healthily and rest more these days. Together with the good report with my families and friends, and the faith I have with God, I start to enjoy and appreciate my life.
Mrs. Chen was being emotional.
But I feel really poor today. It seems a lot worse than yesterday. Does Sito really understand my situation? Did he prescribe me the right drugs? And did you give me the right dosage? I read out your clarifications. I should not stay here. I have to transfer to Hong Kong State Room and Hospital.
Mrs. Chen, the most effective treatment to treat your cancer is therapy. It can almost cure the cancer, and your survival rate is very high. If you don't receive the treatment as soon as possible, you will become worse, and you have to endure more pain. And your family will be very sad. So, we highly advise you to receive the treatment.
No. Taking therapy have to take high risk. And it is also very painful. I am really scared that I will die in the operation room. I won't take any treatment.
Okay, we respect your opinion. Besides therapy, there is another treatment to control your condition. That is medication. But medication is just a way to treat the symptoms, but not the root cause.
Maybe I should try. I should not be so selfish. If I die, my family would be so sad. Taking medication is not that painful as operation. I think I should try. Okay. I will try then.
After 1 week, Mrs. Chen still refused to receive the operation. The doctor came again to persuade her.
Mrs. Chen, although you have taken the medicines already, there is still an indication of spread of cancer cells. We advise you to receive the operation immediately.
No. I won't to do so.
Okay, I give you some time to calm down and to think about it.
After the doctor left, other patients tried to persuade Mrs. Chen. Mrs. Chen, I know it is hard to accept the diagnosis, but what you should do now is to receive the treatment bravely. The therapy is very effective. I know that a lot of cancer patients recover after receiving the therapy.
Yes, I'm one of the examples. I was a cancer patient before, but after I received the therapy, I did feel well. And now, my cancer is nearly cured.
Is that true? Should I really receive the operation? Really? No. I don't want it. I can't bear the risk.
The patients start to feel impatient, and they don't try to persuade her anymore. Mrs. Chen felt embarrassed and have a sense of concern.
Mrs. Chen, if you receive the operation, we can inform the doctor to let you discharge and go back home earlier.
After the persuasions of the nurse, doctor, and other patients, Mrs. Chen finally accepted to receive the operation.